had a lot of opportunity to do that. And it's also a lot of fun. So one of
well, thank you for having me here. When Dr. McQuade asked me to go over the situation, I realized when he invited me for the talk discussion that we're just about reaching the important peak. I mean, it's not even the peak in South Asia. Like today has recorded the highest number of cases. The peak as of today has been more than 14,000 people. Is that actually the peak? We don't know. Because from here on, the numbers are just going to rise. But it's not like it wasn't expected. Could it have been avoided? Maybe, maybe not. I'm just going to be a fatalistic South Asian here and be like, who knows? Karma, I don't know. But no, that's not going to be my response to everything. All right.
Okay. Well, with that, allow me to begin formally. Hello, everybody. Thanks so much for joining us. My name is Robert Baines. I am the President and CEO of the NATO Association of Canada. We're so pleased to have you here today to discuss a little bit about how situations like COVID can actually allow us to build on new frontiers of peace. Sometimes collaboration between two countries that are otherwise at odds can really start to build bridges that we would have never thought of before. It's always an exciting discussion. We here at the NATO Association of Canada, we are a charitable nonprofit dedicated to making sure that Canadians understand the value of security and the importance of NATO. It's not something that most Canadians have to think about on a day-to-day basis. So we try to make sure that the issues that involve Canada and international security are discussed in public forum as much as possible. Before I flip it over to Dr. Joseph McQuade, I would like to recognize Samar Khurshid. He has been doing a lot of the back support for this event. So thanks so much, Samar, for helping to put this on. And with that, in order to start the discussion with Dr. Sarcar, I would like to introduce the Editor-in-Chief of the NATO Association of Canada, Dr. Joseph McQuade. Dr. McQuade is also the Director of our Centre for Disinformation Studies, as well as a postdoctoral fellow at the University of Toronto, and he's been a terrific member of our team. Thanks so much, Joseph, and please take it away.
Thank you, Robert. So to start with, although this is a virtual event and people may be tuning in from all over the world, I did just want to start by acknowledging the land on which the Toronto branch of the NATO Association of Canada traditionally operates. For thousands of years, it's been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. And I feel that this acknowledgement is all the more important in light of events this year in both Canada and the United States, which serve as important reminders that the fight for racial justice is ongoing and requires all of us to do our part. If we're to live up to the ideas espoused by NATO to secure lasting peace based on common values of individual liberty, democracy, human rights, and the rule of law, we can and we must do better. So without further ado, I'd like to introduce, I'm very honored to introduce our guest. Dr. Aprajita Sarcar is a historian of medicine, public health, and birth control in postcolonial South Asia. During her doctoral studies at Queen's University, Dr. Sarcar examined the urban history of families in modern India. Prior to her PhD, Dr. Sarcar completed an MPhil in social medicine and community health and an MA in political studies, both of these degrees in Jawaharlal Nehru University, New Delhi. Dr. Sarcar has experience as a journalist, and her broader research interests include urbanity, gendered citizenships, and identities emerging in the cities of post-colonial South Asia. So Dr. Sarcar, thank you very much for being here with us today. I'm really looking forward to the conversation. I will just start by explaining a little bit about the structure for our audience. So the idea is that the first half of this event will be a structured Q&A between myself and Dr. Sarcar. So this should last for about 30 to 40 minutes. This will leave the remaining 20 to 30 minutes for us to take questions coming from the audience viewing the live stream on YouTube. And then we'll kind of discuss those questions in a more informal setting. So to begin with, I do just want to introduce the region, which is the subject of our discussion today. This is an area that is maybe sometimes out of traditional conceptions of what would be kind of an area of interest for NATO, but nonetheless, it is a vitally important conversation to be having. This is an extremely important region, both in terms of population, importance. So with a combined population of almost 2 billion, 1 in 4 people on Earth currently inhabit the South Asian region, consisting of India, Pakistan, Afghanistan, Sri Lanka, Bangladesh, Bhutan, and Nepal. With the novel coronavirus COVID-19 rapidly spreading in the region, India now has the 4th highest number of confirmed cases in the world. Despite this, global coverage of the coronavirus pandemic continues to focus on the impact primarily in Western countries, especially in Europe and North America. So as a result, I wondered if you could start by providing our viewers with a little bit of context for how public health infrastructure in South Asia has functioned over the past few decades, giving a little bit of sense of the history of the region as it pertains to public health, and what some of the region's specific healthcare challenges were before the spread of COVID-19 began.
Thank you. So the way health administration functioned in India, it was replicated on the way late colonial British administration happened in some ways, but also different. Health was a provincial listing, which means that it was not a central ambit of work, because the center dealt with military, with national integration and everything about the security state, whereas provinces dealt with education, health, all the social sectors. And that is how federalism worked in India for a while. And it's sort of similar to the Canadian way, in which some responsibilities fall with the provinces, some are central, and has been the way it's been working since 1947. Over the years, though, especially since 91 and the opening of the economy in India, and I can say pretty much for the other South Asian countries, health and education has been receiving less and less of political attention and funding. And today what we see are systemic inequities that have existed and have emerged since the 1990s. Like this, these inequities are speaking up. In terms of infrastructure not being developed, hospitals, lack of hospitals, or a total breakdown of the public health system in some places, or public health being really stretched to its brink in most of the region. And it's scary, but also it's a way of people to actually talk back and say, well, what are you going to do from here on? It becomes a question of national security, just because if health is going to be a matter that, if public health is going to be a matter that it's not about people, but it's about numbers, then we will systematically be facing more and more such mass scale events and not know how to respond. And we can't have that kind of breakdown of systems, not with the way environmental disasters are coming up, not with the way people are just not sure how everyday life looks from here on. I mean, right now, all of Bangladesh, most of West Bengal is, they're two different things that a lot of people in the North Atlantic world don't know about. There's West Bengal, which is part of India, and there's Bangladesh. Both of them have just suffered a horrific cyclone, something that hasn't happened since the 1890s. So we really don't know the impact that this particular time will have for the entire geography and for the politics of the region in the coming years.
Sure. Yeah, sure, absolutely. And I'd like to maybe just build a little bit off of that point, because certainly environmental security is a major area of interest that we've had other events about here. And so I guess in a way you're saying that what we're seeing now with kind of the governmental responses to COVID-19 and what this is illustrating maybe about state capacity in some cases can potentially be instructive in terms of thinking about the long-term future of the region, because of course it's absolutely true. South Asia is probably the part of the world that will be most impacted by climate change. So yeah, I wondered if you had anything more to say on that topic, or if you'd prefer to kind of move on.
Just, I guess nothing. I'll just reiterate the fact that disinvestment from basic social sector it's always been a bad idea, but something that has been attractive in terms of profit making or like even the IMF regimes and the intellectual property that comes with IMF trading and conditionalities often suggest giving up health and education to private sector, letting the private sector emerge as a strong player. It's worked well in some regions and not so well in others. And we'll see how the pandemic is reflecting and letting that pattern emerge as we talk. Okay.
Sure, thank you. And so yeah, now we'll turn to the pandemic itself. So we can, this is obviously something that is kind of rapidly changing, and so we can talk as we go about how things are changing even day by day. We were just discussing a moment ago that the numbers today, I believe, were the highest that they've been. So we'll return to that. But I did just want to kind of start at the beginning. If we're looking at kind of this past December, January, February, because initially the number of cases in South Asia were quite low relative to other places, or at least the reported or the confirmed cases were quite low relative to other countries like Italy, like South Korea. And so I just wondered if you could speak a little bit about what you think accounts for this. So, I mean, first of all, was it genuinely a slow spread at the beginning, or was this just an issue of not enough testing? And if it was that it didn't spread that rapidly at the beginning, what does this kind of tell us? Does this mean that the initial lockdown imposed by Modi, was this successful? Was it something else at play?
Whether the lockdown was successful or not is an ongoing topic of debate. Some public health activists were staunchly against it right from the beginning, saying any quarantine measure has historically proven to be counterproductive. I'm hesitant to say that it's counterproductive because without a national lockdown, there would still be international flights flying. There would still be people coming in with disease numbers, and that would be just disastrous. I mean, I myself had to take a repatriation flight, and I saw the measures that Air India and the rest of the personnel were taking to make sure that we were in quarantine. We were formally in quarantine for at least 1 week, and then home isolation for 14 days. And without those measures, the numbers would be, I mean, they're already off the charts. I mean, they would be worse. The reason the disease came late, I think it's just a question of, irrespective of politics of the nation and whether they were ready for it or not, it's just the way the disease traveled. I mean, it's just the way the journey of and the fact that community transmission in India wouldn't even have happened if people hadn't flown in. The fact of the matter is, it did come with rich people flowing in and then causing absolute devastating changes for migrant workers, for the lower middle class, for the working class, and who didn't have any idea it was going to be such a massive pandemic. So it was something that came with people who could afford to travel, at least in South Asia. The disease took a completely different entry point in each geographical cluster, but in South Asia, I can confidently say that's how it came, and therefore it came late, and therefore the peaks are happening now. Apart from the US, it's kind of controlled in the rest of the countries, but yeah, and we'll get to that, why the US and our paths are so similar. Do you want me to go over the numbers as of today?
Sure. Yeah, we could. We might as well just continue with along that line of conversation. Yeah.
Okay. So as of today, I'm just taking Asian COVID stats because I guess the world stats are everywhere if you just Google. Russia's on top. India is the second, then Iran, and then Turkey. I can give you the website for this. This is cov19.live, the one which is run by some teenager. But it's credible. He's done a good job. Anyway, that's a side story. So 491,168 cases. That's a spike of 3.84% as of today. 8,944 cases which are critical, and 15,308 deceased. Now, what that essentially means is people are coming to the hospital late, which means if you have signs of the disease, you're not realizing that you have COVID, and then you're coming to the hospital, and chances of recovery are really low. And that impacts your figures for recovery tremendously. So even though we have a very high recovery rate, the transition from critical stage to recovering are pretty low. This is very different from, let's say, Pakistan, where the numbers are low, 192,970 cases with 3,000, just about 3,000 critical cases, and deceased are comparable, 3,903, which means that people are coming to the hospital. A lot of them are also recovering, because the people who are recovering, that ratio of critical cases to recovery is slightly higher than in India right now. And that is probably the mismatch of testing that has been happening in India for quite a while now. Now, another reason the cases have spiked since day before is because testing has been ramped up in pretty much Delhi, Bombay, all the places where people were complaining of just reaching the hospital and losing relatives. Just straight up in scary stories of someone developing breathlessness and then pretty much passing away in like 3 hours or like a day's time or 24 hours. So it's that asymptomatic nature of the disease where people don't realize that they are affected until it really reaches a level where they can't be saved. So I will keep bringing up Pakistan as a contrast, not because, well, there's always that history, but because I think there's an interesting development going on in national figures. The other comment I want to make about the nature of the spread is it's mostly urban. Now, these are just tentative figures that I am seeing. I'm not a demographer, I'm not a social epidemiologist, but given whatever little skills I have built in 6 years, I believe that wherever there is a population density, which is very, very high, and urban, those are the places which are getting really, really affected. Now, that doesn't mean that this urban spread can then be disaggregated along caste or class or gender lines. In Korea, I heard that a lot of the first wave of diseased were women, urban women. Now, that is something that I just read, so I don't know the reasons for that. But in India, you don't have such, it's not possible to disaggregate the spread in that way and make sense of it. Like in Delhi, you have middle class quarters, you have lower working class people who are not, like those spaces are not contained, which means they have no diseased people. So even if the state wanted to sort of go in by saying, let's contain and quarantine all the lower working class settlements, it doesn't follow that logic. and which has historically been the case with plague measures. The logic of the disease always goes beyond what the state expects. It's not always just working class people who carry the disease in that sense. Never have, actually.
Sure.
And then the last thing I want to say is that there is about the spread. The spread of the disease is dependent on the way the state is handling and the state's response systems, which is why the deaths have doubled because the state has not been prepared. On the other hand, not all states have reacted the same way. And that is where the federal nature of the governance system kicks in, is that some states have historically done better in health administration and some states have not. So the ones that have done well, they just have excellent feedback loop with like middle rung and lower rung bureaucracy, medical personnel, and other states don't have that feedback loop. So there's just chaos.
Sure. And on that note, actually, one aspect of this that's been very interesting has been the success. I know there have been more cases starting recently, but Kerala has really been a bit of an outlier, not just in India, but really globally as kind of a subnational unit that has actually managed the crisis very well. I wondered if you could just say a little bit about that, because I think it is a very interesting case study.
Well, it is the last communist state, but I don't think that's the reason as such. But it's because there's a respect involved for health workers, right from the level of social workers to like midwives to the health workers who work on ground. There's an excellent feedback loop from women, especially women at that level, reporting back to district level administrators, who then have a way of making sure the center or the state administrative level knows that there are certain such cases. That feedback is through Twitter, through Facebook, through WhatsApp, through just there's a whole lot of communication happening, fast communication, which doesn't require a lot of red paper. It doesn't require people to follow through some hoops. KK Shailaja, she herself, the state health minister, she has seen Nipah. She has seen so many other disease spreads, which are sort of similar to the way Ebola, to the way this current pandemic is working, that the state was somehow just better at managing and troubleshooting feedback loop. But that has essentially that has saved the state. And wherever there is a lack of respect for lower rung workers, that's where you see the medical system just collapsing. I mean, that reasons for those for that lack of respect could be many. In America, it takes or in the US, not in America, it takes race is a factor. Do you take Black medical personnel who actually form the majority, the base of health workers at the lowest level? Are you taking them seriously? Are you listening to them? Are you providing them PPEs? Actually, the state is not doing that. So what are the state's priorities? And in Kerala, you see a lot of respect because historically, again, it's about the anti-caste movement, the way the bureaucracy has understood land reforms, all of those. A pandemic is where you actually see history play out. And which is not to say that other states have not had self-respect movements and all of that, like Tamil Nadu does, but numbers are high. There's a whole lot of chaos there because the feedback loop hasn't been established. Maharashtra, for instance, Bombay, basically, where Bombay is placed. Up until last week, numbers were crazy because I think there was just a lot of chaos in terms of population density and existing hospitals and primary health centers not being able to cope with the number of people who just come in, who are breathless, who are basically on the last stages. And but now there's been an excellent feedback loop. And Dharavi, which is the biggest slum cluster in Bombay is that's where Slumdog Millionaire and all of that was shot. It hasn't recorded any new cases in the last 3 days, which, so if we let that pan out, that means Dharavi as a village cluster right inside the city has managed its numbers. And that couldn't have been possible without social workers. That couldn't have been possible without families trusting the state to actually do its job and telling people, okay, I think I know someone who's not doing well. I think you need to look at him or her. That kind of reliance is missing in Delhi as of now. The people are not so sure state administrators have that the wherewithal to take on more and more cases. So that's what's scary. People's lack of trust, or that sense of like, are they going to be able to do it? But now that testing has gone up, there's a little bit of more state presence you see around. You're getting messages every day saying, if you see any symptoms, don't come to the hospital yet. We're sorry, but you can do these things. So the fact that the chief minister is able to, and this is not the prime minister, I'm saying chief minister, I'm talking only at the level of states right now. The center, unfortunately, is not in the picture. Fortunately or unfortunately, is not in the picture right now. People can talk to this chief minister and say, well, okay, he's trying. We'll see, everybody's trying. Okay, let's do this. So there's a sense of, okay, everybody's trying. In Pakistan, I think Imran Khan has done that. He has become the face of like, maybe he's trying to emulate Trudeau, or like just being able to come up with, or Jacinda Ardern, I mean, it could be anyone, but daily press conferences are a thing. He is the face of any question, I mean, whether people are reaching out to him or not is a different question, but he is that face. But in India, it's more the chief ministers at the state levels who are the faces of disaster management. Yeah, that covers some of, and if I've forgotten something about COVID testing, I'll tell you. Oh yes, data representation. Do you want to ask a separate question about that, or can I just?
No, you can maybe discuss that now. That's fine.
Okay, so there is a national COVID data dashboard or registry. It is keeping track of numbers coming in from nationally, and it has some sort of a breakdown of state-wise data. Like, okay, we know, for instance, Maharashtra is leading, or Uttar Pradesh. These are the big states which have the most number of cases, and then Delhi. All three of these are the biggest, problem cases. But district level data is in the state health website. Both Bangladesh and Pakistan, when I saw their dashboards, basically the national website has everything. That's probably because the states don't want to keep a separate website for themselves for reinventing the wheel or whatever sizes of, I don't know, but definitely more accessible. Having said that, I mean, I guess the Indian numbers are so big, they're changing so much that it's probably better for the states to handle district level data. Pakistan has actually put demographic details of patients, reported deaths, and the demography of people who are at risk, who are in critical cases, who have passed. But we don't, I mean, by we, I mean, the Indian websites haven't given that kind of data. So yes, there's definitely a lack of transparency. And it's probably emerging from the fact that, I mean, it's just not keeping up. The system is not keeping up with the numbers as of now.
Sure.
The situation will change every week, so yeah.
Yeah. So I wanted to build off of there were 2 points that you mentioned that I thought were especially interesting. I liked your description of the pandemic as kind of history, kind of how you can see history in the pandemic. And another point that I thought was maybe related to that is this discussion of public trust, and how when you break it down to the state level, you can see different states with different levels of trust, and maybe in comparing it to the American case, how this crisis has really brought to the forefront political issues, but also racial justice issues. And so in India, the kind of one thing that does stand out on both of those fronts is, of course, the relationship with India's Muslim minority. And so I know that there has been a lot of misinformation circulated regarding kind of referring to it as the Muslim virus, and a lot of these kind of conspiracy theories about Muslims spreading it on purpose. And so, yeah, I wondered if you could speak a little bit to that dimension in terms of how that history, in terms of kind of the colonial roots of it, but then also the post-colonial legacies in terms of how India's Muslim community is kind of situated, either in terms of, it, as you were saying, there isn't necessarily the kind of demographic data available on a wide scale yet to necessarily be able to say whether the virus itself has been impacting Muslim communities more disproportionately. I would imagine that's certainly conceivable, but I'm not sure whether that data is there yet. But either way, just how this is kind of how the crisis is playing out in terms of those pre-existing political and communal fault lines.
There isn't any data on lines of gender or community yet. Not that I can find any. Maybe in some years it'll come up, or months. There's this graph floating around on Twitter of how the three countries that are actually doing, where the spikes are happening now, are the US, Brazil, and India. And obviously, there's a whole lot of talk around the logic of right-wing governments not knowing what to do, and not being essentially anti-people. But I think that's a little too simplistic. What is happening right now is that the logic of majoritarian governments is falling apart, and therefore people are dying. And what is that majoritarian policy? You're building your entire politics around the middle class majoritarian society. So in Brazil, that looks different. US, it looks different. But in India, it looks like a typical Hindu middle and upper caste family. Now, they, since 2014, and actually even before that, they have been fed Islamophobic nonsense since in every, like their entire ecosystem is built around Islamophobia. There's a sense of like, oh, since 1947, India has been, I don't know, all sorts of crazy conspiracy theories, as you said, about how India has never seen sovereignty because whatever, maybe they had leaders who were secular, or it's time for the Hindus to rise and all that. So what we see again right now is an exacerbating of a political situation that has been fermenting for so long. Just before the pandemic, we just had a massive round of protests about the constitution around, and the idea of citizenship in India changing, and bringing in like basically clauses around, unless you come to this country till on this date, you cannot qualify to be a Hindu or to be an Indian because you're not Hindu, or because you're not Muslim, or the entire the Citizenship Amendment Act has completely destabilized the very idea of what this nation is supposed to do, what it's supposed to represent. Before that, Article 370, the clause which allowed Kashmir its semi-autonomous region status, was taken apart, and it came under direct central control. We are still seeing the political repercussions of these decisions amidst the pandemic. I'm of course not an authority on any of these topics. My project is on health, but health is political in the sense that obviously we'll see Kashmir being completely under, I don't know, some sort of a black hole in terms of information, in terms of what is actually happening when it comes to patient registers, whether who's falling ill, whether they are getting any help or not. I think people are just left on their own, and that's very scary because out of just sheer self-interest, the middle class realizes that can happen to them. I think what the middle class suddenly realized is that, oh, it's not just Kashmir. It's not just a distant Muslim family getting attacked. It could be any of us now. And that realization is slowly gaining ground. But I mean, all of this sounds like tirade against the regime, but just even if I were to be just a historian and just an academic, it just feels like complete, like this chaos is partly the current regime's fault because they festered it. But on the other hand, it's also been going on since at least the 1990s. As I said, the denudation of welfare resources, of health and education. Just in the first half or the first wave, when the first wave of cases started happening, there was an event where there were international Muslim speakers and prominent speakers coming in. I'm not familiar with, because right then I was traveling, so I didn't pay attention to it. Anyway, that vocabulary such as super spreaders, and various like discriminatory ways of looking at the disease and people and saying, okay, this particular conference that the Muslims held led to COVID cases in India, which is complete like BS. That was not the way. I mean, yes, they brought some people there were tested positive, but they were quarantined. They did not go against any of the quarantine policies, and the disease spread is not on communal lines. It is not on caste or class lines. The disease spread because people who were traveling brought it with them. Now, where they're traveling from and how they're traveling everyone was traveling at some point, So there might still be asymptomatic carriers who just didn't know that they were carrying it. Still don't know. So I guess what the pandemic is doing is just like just turning the thing upside down, the logic of communal thinking, the logic of casteist thinking upside down. But people continue to still look for some kind of rationale in like, oh, well, no, those who work with bodies or those who work with actual, like those with occupations like doctors, nurses, healthcare workers who work with bodies, they are the ones who are causing the disease, and they can be of a particular caste or religion. But even if media, and by people I mean media, even if the media, which is catering to this class and middle class, even if it tries, it fails, because the actual reality will not live up to it. And people are realizing that, like, oh, I can fall ill. I'm rich, I can afford healthcare, but I can still fall ill. And then what? So that fear is there. It's there.
Sure. Yeah. So I think we have some questions coming in from the audience now. But just in terms of kind of briefly responding to that point, I'm not sure if it's the one that you had in mind, but I know there was a lot of controversy surrounding the Tablighi Jamaat, the gathering in Nizamuddin in Delhi. And there's been some parallels kind of recently drawn to currently now in Odisha, there's the Rath Yatra festival, which is a Hindu festival, of course, and has been kind of promoted. Even Modi was tweeting about it and saying, this is great. And so I think that there is a clear, as you say, it doesn't spread kind of by religion, it spreads by people. And there is a clear double standard being held in terms of how, when the event is kind of mainly conducted by Muslims, then that's viewed as kind of a super spreader, whereas these Hindu religious festivals are just allowed to kind of remain as just festivals. So yeah, I'd like to, I'll just open it up though with the first question from the audience. And so I think this question is, I think you've discussed it a bit in terms of in the Indian context, but maybe I don't know if you feel comfortable opening it up beyond that to other contexts as well. But the question is just, do you foresee national solutions to address the ethnicity-based inequitable healthcare access. And, you know, perhaps we could say broader kind of inequities in healthcare access, depending on context.
There has to be, otherwise, like I said, there'll be, sorry to say, there'll be more disasters coming in the coming years. And historically marginalized communities have to, either they have to be given representation in the bureaucratic personnel and the medical personnel, and that's happening slowly, or there have to be like community level workers who represent the concerns of on paper all of this exists, and I think that's the beauty of South Asia, is that on paper all of this exists. Federalism exists, decentralized working ethic, whatever, all of that is like great. Like every time WHO says something and we follow it in every way possible, and yet there's discrimination on ground. And yet when a health worker goes around telling people to wear masks, she'll be told to like stand at a distance because she's Dalit. It's that double think which is very, very scary, but it's also so characteristically South Asian. And again, yes, I can definitely stretch that to Nepal, to Bangladesh, to Pakistan. We all, like, in that sense, we all have that sense of like, oh yeah, I know what is the right thing to do, and then not do it. So the pandemic will exacerbate more of these kind of responses, and the only solution to this would be more systematic training, more systematic unlearning of historically inequitous behavior. Now, that would require more than an immediate, like, let's teach people how to wear masks. No, I mean, yes, that immediate thing is there, but more long-term solutions in terms of how to respect hygiene, but not think that diseases are caused by certain people or certain traits or certain population clusters. If that makes sense. Yeah.
Yeah, no, I think that does make sense. And I think that certainly this, the kind of gap between theory and practice, yeah, it is something that we can certainly see. I mean, if you look at the Indian Constitution, there's so much there in terms of, it, especially really for its time, looking at it in the late 1940s, this was really a remarkable document that was put together. But then there's kind of that gap between the theory and the practice. And I think that that's something that goes beyond South Asia too, right? I mean, if we look at other, democracies in North America or in Europe, we often have this kind of rhetoric or these idealist notions of what citizenship entails. But then for many countries, there is, somewhere where that breaks down in terms of what that actually means for people's lived experiences. So I'll just read the next question here. And so this really has to do with relations between India and Pakistan. So, I mean, there's of course been tensions have been really heightened between the two just last year. There was both were kind of on the brink of war. And actually the next question gets a bit more to that. But so the question here is just, does this crisis have the potential to actually bring these countries to get closer together in terms of coordinating their responses? Have we seen evidence of this at this point, or is it kind of hardening those borders, or is it maybe making them more malleable?
I like the intention behind the question, but let's just say that the center, especially in India, is a completely different machine from the state bureaucracy. Looking at the way data is represented, the way, for instance, when you see Pakistan national figures, the dashboard, the fact that Sindh province, it has the highest number of cases. The way they have sort of showcased the details, I wouldn't say Indian websites copied it, but it's more like one learning from the other, but also not letting it be very obvious. So there is a certain level of realization that we are all in this together, which we are. But we also know that nationalism and politics of nationalism will get in the way if you talk about it. So increasingly, I see people sort of nudging and telling each other, okay, I know what's going on, but not really talk about the elephant in the room, which could be communalism, which has to be the Citizenship Amendment Act, which and the general orientation of the government, the national government in India. So would that mean collaboration in middle and lower rung politics, leaders? Not anytime soon, because the media is just so vicious. I don't know whether Pakistani media, the Indian media can actually just, yeah, it's so embarrassing. So mainstream media is what I mean. There'll be repercussions of various kinds from here on. That's all I'm going to say. It's all up in the air right now.
Sure.
We're losing a lot of friends. That's all.
Yeah, so there's the next two questions actually both kind of connect to that one in different ways. So I'll start with the one, it has to do with recent border clashes between India and its neighbors. So China, Pakistan, we could also speak about kind of the rising tensions with Nepal in terms of the map, that kind of creating a new map that claimed territory currently claimed by India. And so the question is kind of about how those clashes fit with or impact India's public health policies and response. And what I would kind of maybe also just throw into that is the relations between India and China, but also between China and India's neighbors, because we have seen in this current situation, we have seen a lot of cooperation between China and Pakistan, for example. And I believe even with China and Bangladesh, we've also seen some supply lines and things like that. So I guess just, yeah. So, I mean, it's a big question, but just I wondered if you could maybe just say a few words about those kind of those bilateral relations and how those kind of fit into the picture.
You're lucky I'm just not related to the government in any way, because I would not have been able to answer this question otherwise. So from the pandemic point of view, there's border clashes will have the impact of centralizing forces and centralizing resources again. Even like any way the Indian constitution is built around the center, like the fact that New Delhi will have the last say on everything. So even now, states can't overrule what Delhi has to say, what the prime minister has to say, or the home minister has to say. There are daily briefings within them, not with the people, not press briefings, but there are briefings that the council of ministers, the chief ministers have with the center almost every day. This border clash was, of course, there's a whole lot of lack of transparency around it, like whether they've been happening for a while. Now, my sense is that this has been accruing over time. We have had scenarios where skirmishes have broken out in the border, with China claiming a different map of India, where parts of India were seen as Chinese territory, even parts of Kashmir. Pakistan has a different map of Kashmir. I've grown up knowing that. India has a different map of Kashmir. It's the map cartography situation in India, South Asia, is a little like, everyone has their own little fiction going on with it. But of course, you can't call it fiction, then you're anti-national. But fact of the matter is there's a lot of chaos, because no one actually is going to go on record and say, no, we don't own this territory, or yes, we do own this territory. When 20 Indian soldiers died and some of them were captured, it was through Twitter that I got to know. The mainstream media was not letting the numbers out. They were instead claiming that 48 Chinese soldiers are captured somewhere in India, which is, no, they weren't. So, I mean, I'm laughing because it's just suddenly the numbers were just 48. And then the prime minister spoke very Soviet style, just came on television and he spoke. But he had this giveaway line of like, yeah, no skirmishes happened, no one entered our territory, and which didn't sit well with the population at all, especially the middle class, which is so patriotic about borders and borderlands. As I said, the fact that Kashmir is not a territory with semi-autonomous status, like it was, somewhat like Tibet, they are different. When you revoke that status, it had political repercussions all through that border. And I think the center didn't think that through. These are the impacts of a domestic policy change. And so every domestic policy change will have international impact. And they just didn't count on Nepal getting upset, on Ladakh becoming a zone of contestation. People have gone to Ladakh. You have Indians going up there and creating a ruckus every summer. But who would have thought that these kind of areas which were neutral ground were going to be under contestation? Now, what they don't realize is, as a historian, I can see, and this is not my area of expertise, so I'm just gonna these are just my intuitive readings or readings from over the years. The kind of neutrality that you saw in the South Asian system was coming from the 1950s and 60s, the non-aligned movement, which was some sort of a vague response to the Cold War power bloc politics. The fact that developing countries could come together and say, well, we kind of have a voice of our own, thank you very much. So what Nehru and the later round of prime ministers could do was build some sort of a solidarity or some sort of a network of countries, like recently decolonized countries, helping each other in terms of infrastructure, in terms of knowledge production, in terms of even student exchanges. That was a SARC. I have forgotten the complete SAARC. Please Google it. I don't want to mess up the expansion, but it exists. These countries were basically the South Asian system coming together. Of course, they were not very politically viable. It's not like they could stand up to, they were no European Union, we know that. But there was some sort of a system of exchange and equality. And that's what's getting upset now. It's that lack of faith that the current government has for itself. And it's happening right in front of us. We can see how nations are getting upset by that. The way the New Delhi is making arbitrary decisions, which actually impact everyone, but they don't consider everyone to be part of, to be stakeholders in a particular situation. There'll be permanent repercussions for these kind of haphazard decisions.
Yeah.
Oh,
absolutely.
do you want to talk about China? China, it's a whole other deal.
It's okay if there's not time. Maybe that'll be a whole separate event, probably.
Yeah. The only thing I'm going to say is Tibet has always been an elephant in the room when it comes to relations with China. Mm-hmm. Of course, in 1962, when the skirmishes broke out, the only actual attack that happened between the two countries officially, it was called a skirmish, not a war. And there's been, of course, the US did get involved there, was about to get involved. There's some readings around that. Again, right now, the right wing in India has historically always recognized Tibet's independence. They've always had a soft corner for the Dalai Lama. But they have also always invited business, especially in health, like pharmaceutical companies, like some pharmaceutical companies, some PPE has come from China, like they have been produced and imported from China. That had become the normal order of day, like Chinese cell phones, that's world over, right? Most of things were made in China. So there was that business element, but there was also this overall international stance that India had taken since Nehru of no, the Dalai Lama is here and we are going to take care of him or whatever, in this very nationalistic tone. It does Tibet does figure, again, as an elephant in the room in the way the nation is responding to the current clash at the border. That's all I know about it, is that it's actually not a two-party process. It's actually a three-party process. And now it's increasingly becoming a multi-party process where Nepal is involved, Bhutan, Ladakh. And so actually that's a good thing. The more actors, the better, rather than just having two nation states fight off each other on some sort of xenophobic logic. So it's a very new chapter in India's international diplomacy.
Sure. Yeah, and I'm sure something that will continue to develop quite a bit going forward. I mean, we have seen that as kind of occurred with the previous federal election and the kind of ratcheting up of tensions with Pakistan, we have seen that it does seem to be a bit of a tendency of Modi to kind of saber rattle a bit, kind of picking a neighbor and then rattling his sabers when things are otherwise maybe not looking as good, and having kind of come under pressure for everything surrounding this current crisis, which, as you say, there's been kind of a mixed messaging or kind of just uncertainty in terms of what the role of the central government actually has been in this crisis. It does also seem that that could be something to kind of factor in. Certainly, as you say, you know, these border tensions go back to the colonial period, so it's not that this is anything new, but in terms of how these kind of connect with the current crisis, I think maybe there is also kind of that dimension of you know, being able to use these as a way of kind of galvanizing public support at times when it seems to be otherwise lagging. So on that,
in terms, I just want to say that in terms of the public health impacts, there will be a short supply of essential drugs if this continues this way, because so many of our pharmaceutical actual components come from Bangladesh, from Nepal, from countries in the Southeast Asia. They are also our buyers in that sense. Again, I'm constantly using our place, by our, I mean Indian governments. And we have not historically seen pharmaceutical companies and manufactured as some sort of a area of international security. But this current pandemic shows that, yes, it is, like hydroxychloroquine. The fact that Trump could actually maneuver a move in which India had to produce and export HCQ in massive amounts to US. Thankfully, that entire logic has, I don't think epidemiologists and public health researchers have actually found HCQ to be very, very useful. Or if they have, only not in the amounts that Trump thought would be like the wonder drug. But the fact that you could push a government to do that was because India already had a very strict policy around pharmaceuticals, which allowed it to make cheap, non-patented drugs, which the US domestic market couldn't produce. And then ironically, you actually are like pushing this country to produce more drugs for you, which your own domestic market couldn't do because of the restrictions you have placed on it because of intellectual property. And by you, I mean the United States. The United States has the kind of strict regime that it has on drug supply, on who gets to produce those drugs and who doesn't. India has some essential supplies which cannot be branded, which cannot be, the intellectual property of which is with the state, not with anybody else. And that comes under clash a lot of times because a lot of pharmaceutical companies from like MNCs that are American, they have a problem with that Indian Patents Act. And it has been under political attention for a while because they do want to dilute it under the pressure of these pharma companies. But thankfully, that hasn't happened till now. I hope it doesn't from here on. That's what the HCQ episode should show us, that we need more cheap and available, accessible drugs, and not like property drugs, which will be highly priced, very high in the markets, and basically just be a way for insurance to earn more money. And what's coming under attack is also the system, the stable system that we had of trust and of, again, knowledge transfer between India and Sri Lanka, between the Southeast Asian countries and India. Like, I really don't know how those equations will change post-pandemic, because the Chinese influences in those areas are, they just take them to a different direction. Like, so this, what we're seeing is this breakdown of a system that was in place since the 1950s and 60s. And yeah, the new system, we're not sure what it will look like from here on.
Yeah, absolutely. Well, Dr. Sarkar, I want to thank you so much for taking the time to talk to us. I've really enjoyed it, and I'm sure that our audience has as well. I'll maybe leave it to Robert. I'm not sure if you wanted to close off with a couple words.
Yeah, I'd love to echo Joseph's appreciation, Dr. Sarkar. It's so much fun, although not always heartening to hear all of the issues which our COVID has brought forth. But I am thrilled to just know that we have so many people working like yourself on trying to make sense of it and to try to make sure that we know what we know and what we don't know, as opposed to blustering our way through these things. The rules-based order itself is based entirely upon utilizing a very hard-won habit of testing, recording, and then reaffirming what we want to do, readjusting our course as far as where we want to go, what different style of institutions we want to create. And this is a very cumulative effort, and it's wonderful to be able to speak to you because you're a big part of that. It's really a lot of fun. And I did want to also mention that those who are with us today would be welcome to join our next event, which will be on Monday at 12 o'clock with 3 new authors, Dr. Thomas Axworthy, Dr. Adam Chapnick, Dr. Tina Park, our own Vice President, and moderated by Dr. Jennifer Orange. The NATO Association continues to push to make sure that we talk about these issues that impact Canadians, even though they don't always see it in front of their faces. We have to make sure that these discussions do happen and that, at least peripherally, we're aware how connected we are to the international rules-based order and our many alliances across the world. I'd also like to thank Samar Khurshid for helping to put this on, and for all of the rest of the staff at the NATO Association. And again, Joseph, terrific job. And Dr. Sarkar, we hope to be able to host you again.
Thank you. Thank you so much. I really enjoyed this.
Thanks so much, everyone.